take a little bit of a rest, okay? You want to take a little...
First, let's take a moment to review some key points from the first program in this series, Preventing Nursing Negligence in the 21st Century. In its simplest terms, negligence can be defined as a failure to exercise the degree of care that a reasonable nurse would exercise under the same or similar circumstances. Legally, negligence consists of 4 elements that must be proven: duty, breach, cause, and harm. First, it must be proven that you owe a duty to the patient. Your duty is to provide care that a reasonable and prudent nurse would be expected to provide.
Patience, take a nice deep breath. Good.
Second, it must be proven that you breached your duty to the patient by either omitting necessary care or giving care that is not performed in a safe and effective manner. A breach of duty also covers errors in assessment or planning. Third, it must be proven that your breach of duty caused the patient's injuries.
Let's try to help us. Can you get your feet underneath you?
And lastly, it must be proven that the patient suffered actual harm. In other words, some injury or worsening of the patient's condition occurred as a consequence of your breach of duty. If all of these conditions are proven in court, the patient can recover compensatory and possibly punitive damages. It is important to remember that even when some care duties are delegated to unlicensed nursing assistants, the legal responsibility remains largely with the registered nurse. Finally, the first program provided a brief look at some of the most common forms of nursing negligence. These include falls, improper IV technique and maintenance, improper monitoring of the IV insertion site, patient safety issues, medication errors, improperly performing treatment, failure to respond, and failure to supervise.